Well, taking care of knee pain without having to go under the knife. There's actually a new procedure, Tyler, right here in the Valley that's doing just that.
A new procedure I probably need to know more about. We'll show you what doctors are doing to treat this knee issue and why it could be the next big thing for those aching knees.
Welcome back, everyone. You know, as folks start to age, we all start to get those aches and pains, especially around our joints and in the knees. In fact, osteoarthritis affects more than 21 million people, with 10 million cases specifically to the knee. Treating that pain is certainly hard, and the options sometimes are limited, but there's a new procedure that's changing that. And joining us this morning is Dr. Eric Boyd from the Desert Pain Institute, along with one of his patients, Jerry Cole. Thank you both for being here this morning.
Thank you.
All right, this is a device that's recently just been approved by the FDA, a device that claims the first non-invasive product that's out there. Tell me what exactly it is and how it works.
Well, this is a device for patients that either don't want knee surgery, such as knee replacement for bad osteoarthritis, or they can't have it due to health problems and situations like that. So the device provides two parts to it. It provides a stable knee brace, which unloads the compartment of the knee which has the bad arthritis, and so almost immediately they get some pain relief from the brace. But then the second stage is an electrical stimulation device where a pad goes across the thigh, another one across the knee itself, and provides a low-level electrical stimulation across the knee, which helps patients manage pain and may help with some of the health of the knee so they become more active and do exercise and movement and participate in a lot of the other things that we know help osteoarthritis of the knee.
And tell me about, it's called the O-Active knee device, and Jerry is one of your patients who's been using it. Right. Jerry, tell me a little bit about your situation. How long have you been using this for now?
I've been using it like about 3 or 4 months now.
Okay.
The generator has an actual timer on it of how much time it's turned on, but there's times when I wear the brace and I don't wear the generator.
And how's it feeling?
I think it's a great idea. I was to the point where it hadn't been a good knee to begin with, and had surgeries before, and I was doing good for a few years. And when it started to go the last time, I'd been warned, next time you're going to need a replacement. So when I went in to the doctor, I was fully expecting that I was going to have to face a surgery and all of the stuff afterward to get it going again.
Rehabilitation and everything else.
And they came up with this as a solution. After they took the x-rays and looked at it, they said it would be a good candidate for this. And once they got me fitted and using it, I was getting relief right away.
That's wonderful. So the pain went away pretty quickly.
I was to the point where if I would walk around the block, even with a cane to assist me, that my knee would be sore for days.
Wow.
And waking me up at night sore.
Well, that's fantastic that it's working for you. Dr. Boyd, tell me who does qualify. What makes a good candidate? Jerry said, you know, he obviously was a good candidate. What makes a good candidate for the O-Active device?
Well, basically anybody that has osteoarthritis of the knee, there's stages of osteoarthritis, as you can see on the model here, patients that have mild all the way to severe osteoarthritis. But these are patients that, for one reason or another, they really don't want surgery. They may be too young. Patients that are in their 40s now are experiencing bad osteoarthritis of the knee.
It's starting that early for some.
Starting that early for some, and they can't have knee replacements because they're really too young for such a thing, or they don't want to have knee replacements. Or patients that are older now, living in their 70s, 80s, 90s, that for health reasons can't have surgery, like a total knee replacement. Or patients that just want to put that off for a while longer. They can elect to do something like this, so the device can give them pain relief so they can be more active and do the things they want to do.
What are some of the tips you can give folks? You know, we talk about folks younger and younger having osteoarthritis, usually associated with seniors, but that's not so anymore.
That's not so anymore, and if you read the Arthritis Foundation guidelines for management of arthritis pain, they really recommend diet, exercise, sleep, good nutrition, and vitamin supplements now like fish oil and glucosamine with MSM, things like that that help manage osteoarthritis pain.
Jerry, are you doing any of those other things?
I had been.
You had been, but now you've got this.
And yes, I had tried other things as far as I could. Was when I broke down in to talk to a doctor about, okay, what's the next step, really fearing I was going to have the surgery. And plus I'm young enough yet that there was the fear that even if I had a replacement now, that it would force me into having another one when I was older and less able to handle the surgery. So this was just, I had never heard of such a thing, but I'm willing to try new things, and this is really
good.
I'm resumed all of my activities
That's
that I was
wonderful.
before I went in, so it's really.
And you're not. I didn't see you with a cane either.
No, as a matter of fact, I go to the gym 6 days a week, and one of the reasons it forced me to doctors, I couldn't do my exercises anymore. And so now I'm back to that, gotten all my leg strength back. And
well, you are the model patient, Jerry. Thank you so much, and best of luck to your recovery. Dr. Boyd, thank you for sharing information. Again, it's called the O-Active Knee Device, and Desert Pain Institute is where Dr. Boyd is at if you'd like to contact him for more information to learn about how you can ease some of your pain if you're suffering from osteoarthritis. Thank you both for being here this morning.